morning. Welcome to today's edition of Thursday Health Tips with Lyle. I'm sorry for the break. There was a little upgrade that was ongoing and we're fully back now. So if you have not subscribed, don't forget to hit the subscribe button and you can share this video for others to learn. So on today's edition, I will be talking on the most popularly discussed disease now, which is coronavirus, and it's important for us to know some basic and facts about these diseases in order to prevent spread of this disease. So coronavirus is a large family of viruses that causes symptoms ranging from common cold to a more severe disease, and it has also been reported to be zoonotic, that is transmitted from animals to humans. But don't be scared, the animals that can transmit it, from the latest research we have from WHO, which is the World Health Organization, is civet cat. As you can see the picture on the screen, it presents with symptoms such as dry cough, fever, pneumonia, difficulty in breathing, some gastrointestinal problems, that is diarrhea, vomiting, and so many other common symptoms we see in even some of these common diseases. It can be transmitted through coughing and sneezing. You know, when an infected person coughs or sneezes, the person releases infected droplets into the air, which rests and settles on surfaces or the skin surface. It can also be transmitted by having close contact with an infected person through surfaces or objects that are infected. So how do we protect ourselves from transmission or being infected by this virus? So the WHO, that is the World Health Organization, recommends the following protective measures against the transmission or infection with coronavirus, which is: 1, you wash your hands thoroughly and you wash it often with soap and water. You try as much as possible to clean surfaces or frequently touched objects with soap, water, or you can use disinfectant to clean the surfaces. Use alcohol-based hand rub, for example hand sanitizer. So you should have your hand sanitizer and you can clean your hands with this hand sanitizer as often as possible, especially in places where you cannot access soap and water. Then you cover your mouth. You cover your mouth and your nose with a clean tissue or a clean cloth when you sneeze or you cough, and you dispose appropriately. Use a nose mask when you're coughing or sneezing to prevent the spread of droplets, or where people are coughing or sneezing, or a place that is endemic to this coronavirus. And when you want to use a nose mask, you need to know how to properly wear the nose mask and dispose them properly. Use of nose mask is effective with frequent hand wash or the use of alcohol-based hand rub. So I'll quickly run through and teach us how to properly use a nose mask. So this is a nose mask. If you want to use a nose mask, we have two sides. So one of the sides has a metal strip inside of it. So you locate the metal strip and then you place it on top of the nose. So let the metal strip like go round your nose like this, and you hold the elastic band and put it around your ears. Then pull this down to ensure that it covers the whole of your mouth. You remove it from the back of your ears, you remove it, then you dispose it. So while using the nose mask, ensure that your hand do not touch the face of this mask to avoid contamination. And while you are walking, when your hand touches the face of this mask, use an alcohol-based hand rub to clean your hand, or you wash your hand with soap and water to prevent contamination. I hope you've learned one or two things on coronavirus, the prevention, and how to stay safe, and most importantly, how to properly use a nose mask and dispose this nose mask. Thank you so much for watching. Thank you so much for liking. Once again, if you have not subscribed, do not forget to hit the subscribe button below. See you next week. Bye.